Discrimination of People with Opioid Addiction and the Use of Naloxone or Narcan.
Significance. Millions of Americans suffer from the disease of addiction. Globally, this public health concern has garnered more attention over the years as public health professionals struggle to fight against the stigma that has held those that are suffering back from receiving the help they need. This stigma has permeated the culture so completely that even as strides are made to recognize addiction as more than just a mental health issue, people with opiate addiction have been separated more and more from being treated equally. Critics have repeatedly argued that opiate use is a moral choice and have been reluctant to use public funds to fight an epidemic that continues to worsen each year. Despite recent evidence and advances in medical science, the availability of treatment for people with opiate addiction continues to fall short of the growing need. We chose this topic because it ties into so much of what we have learned this semester. So similar to the public reaction to the HIV and AIDS epidemic. Society failed these human beings with addiction by revoking their human rights, promoting injustices, and perpetuating health inequities.
Trajectory. We will be demonstrating how opioid use disorder is a chronic but partially treatable medical condition with a prognosis that can benefit from medication-assisted treatment or MATs. Even with scientific breakthroughs like Narcan, which can prevent a fatal overdose, the stigma and ongoing health disparities still prevent people with addiction from receiving proper care and resulting in countless unnecessary preventable early deaths, making this a public health concern. Through analysis of the historical, political, and health perspectives of addiction, we will show why proper treatment for people with addiction should no longer be delayed in ethical debates. History of opioid addiction. According to Johns Hopkins Medicine, opioids are a class of drugs that include both prescription pain medicines and illegal drugs such as heroin. They are prescribed to treat pain, but often are misused, which lead to an opioid use disorder. Opioid use disorder is a medical condition where there is a problematic pattern of opioid use where the side effects must occur within 12 months. That is defined by not being able to refrain from using opioids. Symptoms of the disorder include cravings, drowsiness, weight loss, and sweating. The addiction causes dependency that may affect a person physically and even interfere with their daily activities. 3 drugs are known for use in treating opioid use disorder. These drugs are methadone, buprenorphine, and naloxone. And we will be focusing on naloxone for the remainder of this presentation.
History of naloxone and Narcan. Naloxone is a prescription medicine that can block the effects of opiates with no life-threatening effects on the opiate users. Naloxone is administered to someone after an overdose. An overdose occurs when a person takes a lethal amount of opiates, such as an illicit drug, for example, heroin, or prescription medications like oxycodone. Opiate overdoses can lead to depressed or slowed breathing, confusion, and the lack of oxygen to the brain. Once administered, naloxone takes 2 to 3 minutes for its effects to be felt. If an overdose victim does not wake up, a second dose should be administered. Narcan is a nasal spray delivery system that of the drug designed for use by people without medical training, which is important as more lay people are finding themselves in a position where they need to administer this drug. Naloxone was initially approved by the Food and Drug Administration in 1971. And the molecular entity has long since lost its patent. The new patented delivery mechanisms, however, have changed the proposition for its use. The prescribing and dispensing of naloxone varies by state. Within states without an access law, naloxone requires a written prescription by a physician. In these states, physicians who prescribe and individuals who use naloxone may be concerned with their lack of immunity from criminal and civil liability or professional sanctions in the event of a fatal overdose. And now for the size and scope. As you can see, the United States of America is among the worst of the countries investigated in terms of overdose deaths. Opiate overdose is the leading cause of unintentional death in the United States. From 1999 to 2016, opiate overdose death rates increased in every state. Patrice and I would like to share with you some information from our areas about opiate addiction. In Baltimore City, there has been a standing order policy in place since 2015, which eliminates the need for individual prescriptions despite concentrated efforts to increase distribution and training. Many people have never received Narcan. In Boston, the Good Samaritan law protects a person having an overdose and people who help by providing protection from arrest and prosecution. for drug possession and encouraging someone who sees a friend or stranger overdose to seek emergency medical help. The goal is to save lives and protect people, so they will call 911 right away. The Department of Public Health also issued a statewide standing order that allows retail pharmacies to dispense naloxone without a prescription. Naloxone distribution programs like this are also implemented as a harm reduction strategy in Europe, Australia, and North America, as well as in Central Asia, where the United Nations Office on Drugs and Crime is funding the SOS initiative, Stop Overdose Safely, that started Narcan implementation in June 2019.
So, social justice challenge. We will be discussing human rights, social, economic, and political standings. So first, human rights. Healthcare and access to medications. In 2012, there was a public meeting hosted by the FDA to discuss whether naloxone should be an over-the-counter drug and if the intranasal version should be FDA approved. Regardless of the overwhelming support from the representatives in favor of the changes, the FDA did not change it, and naloxone is still a prescription drug today. Without insurance, one may not be able to even afford the medication. Based on the UDHR, this violates human rights 2 and 3, which are your rights to not be discriminated against and the right to live. 26, the right to education. 28, a fair and free world. But most importantly, humans have a right to resources necessary for their health, or human right number 25. We wanted to share a news story with you all that occurred in Boston, where a Good Samaritan had found a person who overdosed in the bathroom of CVS. Knowing what to do, they asked the pharmacist for Narcan to save that person's life while they called 911. The pharmacist had refused to provide the drug unless it was paid for by that person. Now, let that sit in for a moment. Because the person unconscious on the floor did not pay for the drug to save their life, they could not receive it. No matter how it's twisted, this reality is still the reality. With limitations of accessing Narcan, inability to afford the medication, and a need for an administrator, people with addiction's ability to receive equal health care for their disorder is infringed upon.
And now for the social aspect of social justice challenge. Stigma has been a major issue and prevents people with addiction from receiving proper treatment or even feeling comfortable to seek treatment. As we touched upon when discussing the HIV and AIDS epidemic in class, people with addiction have been looked down upon in society. Instead of being treated as having a mental illness or disease, is viewed in society as a choice or behavioral issue. Many arguments on social media platforms argue that if naloxone and Narcan are free, insulin should be too. The counter arguments that typically arise also argue that opiate addiction is not like other health issues, and that people with diabetes or cancer don't make the choice to put themselves at risk of contracting these illnesses. While both sides try to make valid points, the truth is that more and more preventable deaths are happening each year as we debate. And now for the economic side of the social justice challenge. Walgreens announced it was making naloxone available without a prescription in all of its pharmacies in several large states. While states and organizations are trying to expand access to the drug in communities where it's most needed, price increases have community organizations, first responders, healthcare providers, and state governments up in arms, and demand is rising. Pinning down naloxone pricing is difficult because costs vary from state to state by insurance plan, contract, and by manufacturer. Prices also tend to go up faster on the simpler delivery mechanisms like Narcan. State attorney generals and legislators are looking to address prices, but these efforts often fall flat. The New York Attorney General announced an agreement with Amphastar Pharmaceuticals to provide a rebate per dose on the company's naloxone kits for police departments and other agencies. The rebate was also provided to several other states. The company has even graciously agreed to increase the size of the rebate to match any rise in the wholesale price of naloxone for the following year. And now for the political aspect. Reducing opiate abuse and controlling overdose deaths is an important policy goal for both state and federal governments. However, there is still no bill passed to combat the structural issues stemming from states' failures to respond to the exponential rise in opiate overdoses in an effective and timely manner. The federal government still does not provide funding for the exclusive purpose of increasing access into use of naloxone. Congress did, however, pass the Comprehensive Addiction and Recovery Act that provides access to grant and agency mandates to help with opiate overdose. The ONDCP, CDC, and SAMHSA have also issued policy statements which allow grant awardees to purchase naloxone for first responders, law enforcement officers, and public health organizations. States continue to implement new laws to allow the use of naloxone. It is slowly getting easier to buy naloxone, but the lack of insurance coverage, copay stigma, and rampant lack of awareness for prevention programs continues to stand between people with addiction and the help they need.
Public health challenge. In October 2017, the White House declared the opioid epidemic a public health emergency. According to the CDC, in 2018, 67,367 drug overdose deaths occurred in the United States. Opioids, being involved in 48,802 overdose deaths, are currently the main driver of drug overdose deaths. So, why is this a public health challenge? Well, by denying a person free naloxone, it is against the public health core function of assurance because it didn't provide accessibility to naloxone when needed. There are many hoops that most people with addictions will not be able to accomplish, such as making a copay or having insurance to help with bills and consistent refills. The policies created do not fully cover the needs of this community. Focusing on the 10 essential services, the second and third principles of the ethical practices of public health discuss how policies and programs should be created to provide opportunities and respect the rights of the community members. In this case, people with addiction. Based on the information we share with you all, this is clearly not the case. These policies do not provide the most effective laws or programs to help these people, to help themselves, or even to receive aid by providing free and easy access to naloxone. The state level responses have been their so-called attempts to limit the supply of opioids through prescription drug monitoring programs, or reducing the number of overdoses by authorizing the more widespread provision of overdose reversal drugs, such as naloxone. So, what's next?
As we have discussed, there are major health inequities with the distribution of and access to Narcan. The fear of police and the aggressive response by overdose victims after receiving Narcan may prevent access and willingness to administer Narcan during a witness overdose. In states that require prescription, it makes it so that people with addiction without health insurance cannot obtain Narcan. Also, the cost alone may prevent low-income communities from purchasing Narcan. A lot of people with addiction may fear judgment when reaching out to healthcare providers to receive proper care. By challenging the idea that opiate addiction is not just a law enforcement problem, but a public health concern, we argue that naloxone and Narcan should not remain a prescription, but become an affordable over-the-counter drug. And now for the policy framework. As we discussed, naloxone access laws, all jurisdictions now have laws that address access to naloxone for people at risk of opiate overdose. In 38 jurisdictions, a layperson is immune from criminal liability when administering naloxone, while 37 of those provide criminal immunity for prescribers who prescribe, dispense, or distribute naloxone to laypersons. 49 jurisdictions authorize pharmacists to dispense without a patient-specific prescription, while 43 of those also accept prescriptions from another medical professional.
So now we would like to share with you guys the 3 NGOs that we felt fit all of our mission statements. So the first one was Adapt Pharma, second, Amoca Mobile Health, and lastly, PA Stop.
So Adapt Pharma is a privately held company committed to expanding affordable access to Narcan nasal spray and to progressing treatment options in the field of addiction. Adapt offers Narcan at a discounted public interest price to qualify governmental and nonprofit organizations, including law enforcement, firefighters, emergency medical services, harm reduction groups, and federal and state government entities. Adapt Pharma is also providing free cartons of Narcan nasal spray to high schools.
Next is Amoca Mobile Healthcare. Their mission is to provide a monitoring system to healthcare locations nationally to help keep track and maintain regimens for patients, possibly exposed staff members, and etc. Their current activities include helping a methadone clinic in California monitor their patients, by making sure that they keep taking their medications and going to their treatment therapies. And one of their recent accomplishments include their expansion due to telehealth monitoring per COVID-19. And lastly, PA staff. Their mission is to provide people with increased awareness, education, and information on how to seek help. Their most famous campaign is the Prevention Week, which had just passed from May 11th to May 15th of this year. Their accomplishments include using this campaign to increase concern for a halt to substance use and promoting the treatment for mental health.
And now for our advanced set of recommendations for response that would enact social justice. For states that are yet to remove the requirements for prescriptions to access drugs and do not have legal protections for overdose prevention, they should work to change their laws to make administering Narcan simple and legal. No more should human beings fear calling 911 when they see a life in danger. Regulations to limit insurance companies from not covering this life-saving medication should be put in place. These policies should be national as well as state to show the nation's support for making a positive change. Naloxone has been proven to reduce opioid use disorder and related deaths and should be made an over-the-counter product to improve access. Access to and education on naloxone should be made available in community settings such as libraries, community centers, rehabilitation centers, and hospitals. People suffering with addiction should not be shamed into avoiding the necessary treatment they need or into avoiding access to life-saving medications, and Narcan should not be outside of anyone's price point. We can no longer put a price on human lives. Thank you so much for hearing our presentation. And as you'll see, these are our references listed.